Okay, seriously. For today, Jules for Gem. Yes, I'm Kara Jo to Gem. I do gym therapy. I'm going to be talking to you parents. This is real serious, like for real. Parents who see that their kids have suffered through a trauma and do not get their children therapy. I'm not saying that therapists can solve everything, but I want to give you a alternate perspective to help you understand a few things about mental health. Okay? So, if your child was to fall down and break his arm, many of us wouldn't attempt to reset it and bandage it and put it in a cast on our own. We would probably go to the hospital, utilize their facilities, utilize the expertise of trained professional nurse, doctors, x-ray technicians to determine how serious the problem is with our child. For broken bones, for injuries, for illnesses, for exposure to certain diseases, we would get our children checked out, and most of us would opt to get our children some type of care. So even for for individuals that don't believe in traditional medicine, even if you believe in holistic treatment and herbs and spices. I don't know if there's spices, but herbs and everything, you would get your child some type of care. So I want to understand or rather help individuals, parents to understand that while you cannot see the effects of trauma on a child, understand that children are not built with the capacity to be able to understand the complex situations that we go through in life. And it devastates them. Trauma is like something exists. I like to describe it in therapy as a wrecking ball. A building, your mind being the building, and a wrecking ball hits the building. And in some instances, the damage is small, just a few broken windows. In some instances, an entire floor is knocked down. And in some instances, the buildings collapse. That's the way mental health is. Mental health is not to be taken lightly. When things happen, they affect our mind. We as adults struggle to deal with things. So when your child experiences something or exposure, like if you were exposed to a virus, you would basically take your child's fever and check them out. Well, guess what? Children are exposed to a lot of things that have an impact on their mental health, the way they think, the way they feel, the way they process information. And parents, I implore you to get help. Get help. What does help consist of? Well, just like any other medical ailment, disease, defect, brokenness, everybody's process and treatment is different. Some kids really do need medication to help stabilize the chemical imbalance. Remember that wrecking ball that hit the building? Well, it creates chemicals. And sometimes the body doesn't repair itself totally without chemical assistance. So you'll see kids that can't control their emotion. They have an emotional dysregulation. Bipolar comes from trauma. Borderline personality usually is rooted in trauma. Most of the mental illnesses that I treat as a therapist come from some type of trauma or hereditary or, there's a lot of different reasons. But my point is that if your child was exposed to something, a situation or circumstances, get them checked out. If your child experienced some type of trauma, get them checked out. Sexual abuse, sexual trauma, domestic violence, divorce, things that a child, an underdeveloped mind cannot totally process. Stop talking to your kids like they're adults. They do not understand you. Trust me, they don't. They don't have the frame of reference to be able to understand you. So help. What type of help? Well, it depends on the damage. But you know what, parent? You are too emotionally attached to the situation to be able to properly assess the damage. Get professional help. What does a therapist do? I'm glad you asked. Therapy, basically, we're trained listeners. We're trained to listen to these type of disruptions or illnesses. We're trained to listen for them. That's when we go to school for 6 years and get licenses. Me, myself, I have like 3 licenses, 2 certifications, just to help me listen a little better, to listen to emotional processing, to listen to emotional regulation, to listen to cognitive distortions, to listen and identify when there's some symptoms of some type of illness. Okay? You know what? You're not trained to do that. Google cannot teach you how to be a therapist, okay? Get a trained professional. In my next video, I'm going to tell you how to identify a good therapist. But this video, oh God, my laptop fell. This video is specifically to encourage parents that if your child was exposed to some type of trauma, if domestic violence, sexual abuse, childhood abuse, neglect, anything, get them professional help. If your child was exposed or maybe it didn't happen directly to them, but they witnessed it, get them help. Make sure that you identified what could be affecting them mentally, and don't be afraid to get treatment. Mental health treatment is not a bad word. Okay? Crazy? Throw that out the window. You know what? Like Seal says, sometimes we all gotta get a little crazy. This world crazy. Alright? Anyway, this is Kira, GEMtherapy. I'm gonna be here with a few more therapeutic tips, hopefully regularly, but this one is for parents. Please get your children professionally assessed and get them treatment. Please, please. Don't just think talking to them is gonna work. You wouldn't just talk to them if they broke their arm. You wouldn't just talk to them if they had some type of terminal illness. You wouldn't just talk to them if they were vomiting and retching and feverish. You know what I mean? These behaviors that you see or that you witness are indication that something else is going on, okay? I love you, gems. Peace.